Welcome to the deep dive. Today, we're jumping right into a really central paradox in how we treat major depressive disorder.
Mm.
We have this therapy, Transcranial Magnetic Stimulation, or TMS, that's proven it's highly effective and it's really well tolerated. It consistently delivers strong response and remission rates.
And yet, and this is the big yet, if you look across the psychiatric landscape, the data just shows that adoption among clinicians is, well, it's way lower than the clinical evidence says it should be.
Right.
The science is basically settled. The integration is not.
So that's our mission for this conversation. We want to analyze why this adoption gap exists. We've gone through sources that focus on the current trends, the real value of TMS, and most importantly, the practical steps that providers you can take right now.
The goal is to move TMS from being, this extra service to a core part of your practice.
Exactly. This is really for psychiatrists and providers who already know about TMS, but you want to stay updated on how to really maximize it.
It's all about optimizing the delivery of a treatment we already know works.
It is. Okay, so let's unpack this. If the clinical results are so good and we're all trying to get better patient outcomes, why is there still so much hesitation?
Well, the sources, they really reveal a pattern. TMS, even though it's neuroscience-based and really predictable, is it just routinely introduced way too late in a patient's treatment.
Too late.
And sometimes, worse, the research shows a huge number of eligible patients never even hear about it as an option from their doctors.
Wow. That is a massive missed opportunity. The sources suggest that even with all those proven strengths, it's the perception of complexity.
Yes.
Things like administrative pressure, scheduling, or just, not being familiar with it. It makes TMS feel distant.
Untouchable, almost. It feels like this massive logistical mountain to climb.
Yeah.
And that perceived hurdle, that's the critical bottleneck. I think what struck me most was this key misconception about who the treatment is for.
Okay.
Clinicians still, by and large, see TMS as something reserved for, what they'd call the most difficult cases.
The last resort thinking.
Exactly. And that framing, it just slows everything down. It consciously pushes this safe, non-systemic treatment to the very, very end of the line.
And when we do that, when we put it in that last resort box, we're basically limiting the number of patients who could get better sooner. They're forced into more medication trials, more side effects that could have been avoided. It's a delay that's based on perception, not on clinical need.
And that delay is exactly what we have to overcome.
Okay, so before we really dig into the root causes and, how to fix them, we do want to thank the sponsor that made this whole exploration possible.
Yeah.
This deep dive is brought to you by the Blossom TMS team at www.blossomtmss.com. They help practices implement high-performance TMS systems that are really engineered for reliability and clinical confidence.
Okay, so let's get into those mechanisms that are slowing us down. What's so fascinating is that the sources, they clearly point to three distinct barriers. And these aren't like huge clinical challenges. They're specific, correctable gaps.
Gaps in training and operation.
Exactly. Things clinics can directly address.
All right, let's start with what the sources really frame as the earliest point of failure. Let's call it the professional blind spot. This is all about limited exposure during residency.
Precisely. Psychiatry residents get tons of and absolutely necessary training in psychotherapy and meds, but there's this really inconsistent exposure to what we call interventional psychiatry.
And for context, that's the field using things like TMS, ECT, ketamine.
Right. All the evidence-based non-pharma methods. So the gap isn't foundational knowledge. It's practical hands-on experience.
Right.
Without structured TMS rotations, a new doctor just feels unprepared.
It stays as this sort of abstract idea instead of a tool in their toolkit.
And that creates uncertainty. If you haven't done it with supervision, you're just not going to be as confident recommending it when you have your own practice.
So if the first problem is a knowledge gap, the second one, and this one seems really common, is just about operational fear. We'll call this one the implementation myth.
Ah, yes. The myth that you need a huge team or these super complicated tech skills, or that it's going to completely blow up your workflow.
Right. You picture buying this huge, complex machine that's going to break down all the time and need a team of engineers.
Exactly.
But wait, hold on. The sources call it a myth, but aren't they kind of ignoring the huge cost of the machine itself? I mean, doesn't that financial risk sometimes outweigh the operational simplicity?
That's a really good question, and the sources distinguish between capital risk and operational risk. The initial investment, yes, it can be high, but the day-to-day operational reality, it's much, much simpler than people fear.
How so?
Modern TMS systems are designed to make things easier, not harder. For example, the sources point out that your existing medical assistants can often be trained pretty efficiently to manage the actual sessions.
So if we're talking about minimal disruption to the doctor's own schedule.
Exactly. These systems are built for consistency. Things like, tech that ensures consistent coil placement, streamlined protocols. It means the focus stays on the patient, not on fiddling with the machine.
Ah.
When practices actually look at the logistics, they find the barriers were, and this is a quote, smaller than expected. The doctor's time is focused where it should be, on diagnosis and check-ins.
That makes a huge difference. Okay, so that brings us to the third challenge, and this one really hits at the clinical guidelines, the eligibility straitjacket.
This is all the historical baggage.
Yeah.
The common idea is that TMS is only for patients who have failed, 4 or 5, a whole bunch of antidepressants.
The ultimate last resort.
Right. But the sources are really clear.
Yeah.
The clinical standard is shifting. We should be using TMS much, much earlier.
That is the key takeaway.
The evidence supports considering it when medications just haven't worked well enough or they've caused intolerable side effects. And think about what intolerable means for our colleagues listening.
It's not a minor thing.
No, we're talking about things that make people stop treatment entirely. So offering TMS after just 2 unsuccessful trials or where side effects are a major issue, it can prevent years of suffering.
But that requires a shift in the whole practice. You'd need, clear, simple referral guidelines for everyone.
Yes. Moving from this complex case-by-case decision to a standard process. It creates consistency and just speeds up everything.
It basically creates a new baseline for good care.
Mm-hmm.
Okay, so we've identified the problems: the professional blind spot, the implementation myth, and the eligibility straitjacket. Now let's pivot. Because addressing these things, it translates into real concrete benefits, not just for the patient, but for the practice itself.
For patients, the benefits are incredibly clear. You're offering relief that's highly effective, and this is critical, extremely well tolerated.
Right, relief without all the systemic side effects.
Ex-
And patients really appreciate having that non-medication option. It avoids that feeling of endless trial and error with different pills. It's a real alternative for people who just aren't getting better with meds.
From the clinic side, the benefits are really strategic. Offering TMS immediately expands what you can do. It diversifies your care.
It makes the practice less reliant on just medication adjustments, especially for those tougher cases.
Right. It supports a more comprehensive model. You're integrating cutting-edge neuroscience into what might be a mostly pharmacological practice.
And let's be honest, in a competitive market, practices that offer TMS are just better positioned to meet patient demand for new solutions. It's a way to offer more complete care.
Absolutely. It raises the standard of care and it sort of future-proofs your practice. You're staying at the forefront of what works.
So with those clear benefits, let's talk about the how-to. What are the specific practical strategies the sources recommend for providers who are ready to make this shift?
Okay, this is where the rubber meets the road. The first big move is to focus on strengthening clinical education, but internally.
Meaning regular internal training sessions, case reviews, maybe even device demos.
All of it.
Yeah.
The goal is to get rid of that initial hesitation by just making it all familiar. So providers can then talk about TMS naturally and confidently with their patients.
That makes sense.
The second strategy goes back to eligibility. Establish clear referral guidelines. We talked about how simple, repeatable criteria make decisions easier.
And the sources gave some clear examples, right? Like 2 failed antidepressant trials or medication intolerance.
Or even just a documented patient request for a non-medication approach. When the whole group uses the same clear rules, the friction just disappears.
Okay, that's smart. What's number 3?
The third step is to dramatically improve patient awareness. Right now, a lot of patients only find out about TMS if their doctor happens to mention it in a short appointment.
So the whole burden is on the clinician.
Right. The strategy is to get that information out there. Use brochures, educational materials, short videos, things that help patients feel informed and empowered. It actually helps with getting them on board and keeping them in treatment.
It builds a better alliance.
Yes. And finally, number 4, which ties back to the operational side, is to choose a system designed for reliability and ease of use.
So picking a high-performance system gets rid of a lot of that initial uncertainty. You're looking for features that ensure consistent coil placement, streamlined protocols.
And just dependable daily function. That is non-negotiable. It minimizes the stress on your team and makes TMS feel like an asset, not a burden. A reliable system lets TMS become a core offering, not just a rare, specialized thing.
This whole shift, it just feels inevitable as the field moves toward more personalized, neuroscience-driven care.
I agree.
The sources really make a strong case that TMS isn't just an alternative anymore. It's an essential treatment, especially for depression, that isn't responding to other things.
And by addressing those three barriers, training, operational myths, and eligibility, clinicians can just feel more confident. They can bring it up earlier, talk about it more clearly.
And that's how TMS finally takes its rightful place in modern mental health care.
I think if you connect this to the bigger picture, strengthening TMS adoption doesn't just help your current patients. It elevates care across the board. It normalizes this kind of innovative, targeted approach.
And that normalization comes from more familiarity, standard processes, and clear patient education.
Those are the levers.
So here's a provocative thought to leave you with. We identified that limited resident training is a huge systemic barrier.
A major one.
So how can clinics that are already successfully using TMS leverage that success? Could they become designated teaching sites or partners with universities?
Oh, that's interesting.
By doing that, they could not only future-proof their own workforce, but also speed up the acceptance of these treatments for the next generation of doctors. They'd be shaping the future of the specialty.
And to build on that, integrating teaching would force those clinics to document and standardize their best protocols, which would create this feedback loop that improves quality for every single patient they treat.
A virtuous cycle. Well, to learn more about a system that is engineered for reliability and clinical performance, you can explore the Blossom TMS therapy system. Just visit them at www.blossomtms.com.
Thank you for joining us.
We'll see you next time.